So on that note, I think I am going to, just so that we are on time and I have a reputation for speaking too much, I'm going to go ahead and invite my wonderful colleague, Dr. Hua Zhou, who in biostatistics department we call Big Data Zhou, by the way. And Hua is going to talk about the challenges of big data and all the wonderful things that he's been doing to tackle it. So here you go, Hua.
First, thank you for the introduction, Sudipto. I have to say I'm always a little bit not comfortable with this nickname, big data. All my colleagues are working, in our department are working on big data. And from today's event, so many colleagues outside of the department are working on big data. So you have to give me more specific, tailored to me nickname, maybe.
I'll start working on that.
Okay, yeah. First, I will give a very brief overview of the research I am doing. So myself has a long-term interest of developing statistical learning method and algorithm for high-dimensional data. Usually, they arise from genomics and neuroimaging and electronic health records. In recent years, I got interested in something called biobanks. So on the right panel are a few data sources, biobanks we are working on. First, the sample size is ridiculous, 500,000, 1 million, or a couple millions. And besides that, for each of the individual, they have all this data available, genomics, electronic health record, and a subset of the samples even have a different modality of neuroimaging. So often I'm just joking with my students, you're not working on big data, you are working on big data squared or big data cubed, So that's the kind of data myself have been interested in recent years. And of course, you can imagine there are all kinds of issues in the biobank data. There's a data quality issue, statistical modeling challenge, and especially also computational challenges. But in the last couple of years, we managed to do something due to the hard work of students, postdocs, and our wonderful collaborators. Here's just a snapshot of a few papers we published last year. And we can see out of biobank, we not only can contribute to basic science like genetics and genomics, but also lots of results have a translational value. For example, precision medicine, diabetes care, and smart health, how they can improve patient care. Actually, the last work, Jing Zhou, my colleague Jing Zhou led the last project, which they find a surprising link between the oral diabetes medication and dementia, which caught lots of media attention. So if you want to know more, ask Jing. So that's a kind of research we have been doing. So and recently, our team is selected as one of the 8 teams nationally for a pilot project jointly sponsored by VA and Department of Energy. And the idea is, VA has a MVP biobank and also a tremendous amount of patient care data. And the data is just sitting there, but it's so hard to analyze them. At the same time, all those national labs have wonderful computing facilities. So the idea is, can these two departments collaborate with each other, use the computing resource at DOE to develop some large-scale AI or machine learning methods to improve patient care? And we are very fortunate to be selected as one of the teams for this pilot project. And I have to mention our team is very, very interdisciplinary. So we have my wonderful colleagues, Jing Zhou and Gang Li in biostatistics, also clinician Peter Riven at VA, and a top computational scientist, Ben McMahon at Los Alamos National Lab. So we are very excited about this coming project. So that's pretty much I want to say about my own research. I do also want to spend a few minutes to discuss some data science related educational activities going on in biostatistics. First, of course, our department are very proud to produce next generational data scientists who can meet the big data challenge in biomedical research or public health. Just a couple of weeks ago, in our faculty meeting, we are discussing student awards. And I feel kind of it's a little bit scary to see how well our students are doing. So they are not only doing very hard technical mathematical modeling, but also they are doing very high impact research. Here are just two examples. Joe Zoller is working on aging and COVID-19 research, and Erica is working on eye disease. And I said it's a little bit scary because, I mean, you go to Google Scholar, they already have like 20 papers and hundreds of citations. I almost feel lucky I already got a job. If I'm fresh, if I'm a fresh biostat PhD, I'm not going to compete with these guys. So that's, of course, our one major goal as a department to educate, to train next generation data scientists. But also, I want to mention our department has spent lots of efforts to create the data science education, not only for biostatisticians, but also for students in our school. I often get students outside of my department ask me two questions. One is, data science is so important, I want to learn it, but computer science courses, it's so hard to enroll and so on. I usually say, you know what, maybe you don't need to look far. Biostat has created a few courses which is going to be a very welcoming environment for non-biostatisticians. For example, there's one course, Biostat 203B, which is Introduction of Data Science, which covers lots of generic data science material. And then students say, oh, that's wonderful, but you know, Biostat course is famous for so technical, so mathematical, so challenging. We just don't want to take it. And then for the second question, I will show the data. For example, last quarter, I taught this class, and here I'm just showing the proportion of students who got A+ in my class. Stratified by major, there were like 4 and 5 students from AP and HPM. All of them get A+, and also a couple of bioinformatics students, they got a plus, much higher than biostat students. And it's not, no, I didn't do this purposely. I mean, it kind of makes sense because data science, of course, there are so much analytical stuff, but also there's a size component, right? And students from other departments usually provide very broad perspectives, you know, how to make story out of data, how to make scientific discoveries. So really, data science is for everyone. So of course, also we go beyond the school. If you pay attention to the school screen, you may see this summer training program. I'm so fortunate to be part of the team led by Mei Wang and Mike Perlip. In this summer training program, we are recruiting students from 3 worlds: community health science, data science, and system science. And we are excited to start working with the first cohort this summer. I know my time is running out, but I have to mention this. So if still you feel there's not enough data science going on in the school, now we have a new degree program, and this is a professional degree program just approved last week by the UC system. And I want to thank all of you for the support, and we are trying to kick off this fall. And we also have some outreach, lots of outreach activities. This is just a picture. Our group works with a high school student in the summer. And I do acknowledge generous funding by the federal agencies. Thank you so much. Yeah.
I think in the spirit of time, we'll now go back to our original first speaker, Dr. Sean Darling-Hammond, who was navigating his GPS to arrive here with a lot of big data in GPS, right? So it's wonderful to have him. And Sean will be discussing 2 major projects that he has been involved in, particularly assimilating data from middle schools. As you look at his slides, it's going to be interesting to see how policy questions are related to big data analysis and how Sean is actually tackling them. So, Sean, the floor is yours. Thank you and welcome.
Hi, how are you? Good. All right. Thank you so much. Hi, everyone. I'm excited to tell you a little bit about how we can harness big data to enhance educational opportunity, particularly for middle school students. But before I begin talking about my research, it's probably worthwhile to say, who is this person that you're going to have to spend the next few minutes listening to? So this is a slice of who I am. I am primarily a husband and dad with two very, very active boys. You can see them lined up there in that little collage. My background is a little odd, so I have a sociology BA and a JD, but also a PhD in public policy, and most of the skills that I leverage in my big data analysis come from the PhD studies. I try to bridge departmental silos, keyword try. It's a big ask, but I think it's important to try. In health, education, psych, and law and policy, so you'll see in my work sort of a bridging of understanding the legal and regulatory frameworks that drive what schools do, and then utilizing that understanding to then understand the kinds of practices that impact student health, right? Or student mental health, which is a psychological component. And I generally utilize three groups of methods: in-depth interviews, which you'll hear nothing of today because it's about big data, RCTs, and then econometric and quantitative methods, which is what you'll primarily hear about today. Just in the spirit of making this interesting, what makes me weird is that I've been on NBC's American Ninja Warrior 7 times. I am now retired fully from the ninja life. I am now fully a nerd. And I lived in Japan and speak Japanese. So if anybody also speaks Japanese and wants to help me brush up on mine after this presentation, I would greatly appreciate it. So I'll be talking about 2 quanti projects. One is called The Dynamic Nature of Student Discipline and Discipline Disparities. Just came out last Monday in the Proceedings of the National Academy of Sciences. And we're putting it together in manuscript in Big Data and Society. And what I'm going to be doing on that project is both talking about how we can leverage big data, understand what's happening in schools, and how that might inform the policies that we can utilize to improve conditions, but also how we tell stories about the data that we have from these big data sets, which often can become inscrutable to lay people as we start to dig deeper into them and use these very advanced econometric and biostatistical analyses or analytic methods. The second project is on the effects of student exposure to restorative practices. It's going to show up in a number of places, hopefully, and will definitely show up in some places, definitely. But the goal of that work is to understand the causal impact of restorative practices, which are school-based practices that help students who've made mistakes make amends. So let's dive in here. First project, as I mentioned, is The Dynamic Nature of Student Discipline and Discipline Disparities. And that project is designed to eschew what could be called the static view. So when we think about discipline and discipline disparities, we typically think of end-of-year totals. In this school, 2% of Black students were disciplined at some point in the year, and 1% of white students were disciplined at some point in the year, and so the discipline gap is 1%, or 0.01 as a proportion. But those end-of-year totals hide or obfuscate some really critical information that could drive timing of interventions or targeting resources to specific schools. So we took atypically granular daily data from over 45,000 students in 61 middle schools in one of the largest districts in the country, and we tracked the daily discipline rate, disaggregated by racial groups, across this entire district. Then, of course, we sliced the data a million different ways to make sure that what we were seeing was signal, not noise. But what we found was, in the early part of the year, we see this rapid growth in daily discipline for all students, regardless of their positionality, their identity. But for Black students, that growth is much faster, which means that we have a growth in the disparity in daily discipline rates early in the year. What does that mean for policy? That means if you're trying to plan when you're going to do professional development for teachers to ensure that they're more equitable, you need to start early. You start in the winter break and you're way too late. It's already happened. These disparities have already emerged and they're probably ossified at that point. So summer makes a lot more sense for the timing of a professional development. But we also found that just the first 10 or 20 days of the school year provide sufficient information about where disparities will emerge to predict end-of-year totals. If this escalation is happening that quickly, that makes sense, right? A static view would have eschewed that or would have obfuscated that. So now we're going to think about how we can target resources by utilizing early year data to figure out where disparities are likely to emerge, right? But all of this is kind of hard to understand if you're not a data-y person, this notion of longitudinal data at the student level being utilized to get a sense of sort of aggregate county or district level trends. So we tried to take our data and make it scrutable, make it palatable, make it impactful by translating our data into sound. So here's a little 2-minute clip of what we put together.
What does it feel like to be a Black middle school student? Does the experience change if you're disciplined, or if your school grows more punitive towards Black students over time? This sound represents the Black discipline rate. When it's faster, the discipline rate is higher. Here's what the Black discipline rate sounds like from the beginning of the year through Thanksgiving break. Each beep you're about to hear represents 20 Black students being sent to the principal's office, suspended, or even expelled. By November, the Black discipline rate is 10 times higher than what it was at the beginning of the year and 50 times higher than the white discipline rate at the beginning of the year. One can't help but wonder how that growing inequity impacts the extent to which Black students feel valued and whether it makes them feel like they don't belong at all.
So a little heavy, I apologize, but I think it's important to make these kinds of data stories come to life. If you just hear the stats that I gave or see that figure, you don't feel what it's like to be a Black student, come into school, feel like things are equal, and then within just a few weeks, experience this palatable and potent inequity, which shifts your experience of school, not maybe just for that term, but forever. Suddenly you wonder if you always have to look over your back or look over your shoulder to see if you're going to be treated differently. How does that change your psychology, your stress response? How does that change the extent to which you want to apply yourself in your studies? Now that we have some sense of the timing of this, we can intervene and hopefully avoid that kind of escalation. So that's one data project. Another data project that is kind of in the realm of big data and ed is about the effect of student exposure to restorative practices. So we don't have phenomenal data on what schools are actually doing, what students are being exposed to in terms of school practices. But we do have a lot of cross-sectional data that gives a sense of what students feel teachers are doing. The California Healthy Kids Survey data system, for example, asks students in hundreds of schools throughout the state, to what extent do you feel your teachers are helping you resolve conflicts with your peers? That is a core practice within the milieu of what are called restorative practices. Practices that are designed to help students repair relationships when mistakes have been made. Can we use that data to get a sense of what schools are doing, and not only what they're doing in 1 year, but what they're doing over time, so we can see how school practices are changing over time? That was the goal of this project, was to look at these individual student slices of data within a school, track the extent to which a school is using restorative practices, then track how schools change in their use of these practices, and tie those changes in practices to changes in student experiences. So what we did initially was create a longitudinal data set of school practices, primarily focusing on restorative practices. We then merged that with California administrative data that follows students year after year and tracks the extent to which they've been disciplined and their performance on smarter balance tests, which are sort of tests of English language arts and math knowledge. And what we wanted to see was when a student goes from 5th to 6th grade and they suddenly have this big jump or drop in their exposure to restorative practices, do they experience a concomitant growth in their academic performance as predicted by a glut of theory? Do they experience a concomitant drop in their exposure to discipline? And if we look at this at the school level, do schools that increase their utilization of these practices also see aggregate school-wide student mental health improve, student exposure to discipline go down, student academic performance improve? So what did we find? By merging this data, wrangling these millions of data points, and creating these two longitudinal data systems and bringing them together, well, first, we found it kind of as expected. When students see a net increase in their exposure to restorative practices as they go from 5th to 6th grade, they do indeed see their ELA and math scores, or English language arts and math scores, improve. And these are change on change models. So what we're tracking is a student's change in outcome as a function of their change in exposure. So they are net of all student-specific or time-invariant endogeneity. That's phenomenal because one of the huge confounding problems we have with big data is maybe we can track people over time, but how can we be sure that what we're seeing is a function of what they're being exposed to rather than who they are? This nets out all that who they are stuff. And the only thing we're now worried about is time-variant endogeneity, and not as big of a concern for these kinds of models. We also see that, as expected, as students get more exposure to restorative practices over time, their risk of being disciplined also goes down. So their weather discipline rate goes down, and their days of discipline go down. And given a huge range of research demonstrating the psychological ramifications of being disciplined even once, the extent to which that's tied to eventual incarceration. These are important findings. I'll close with just this last little chart, which is what happens as schools grow more restorative over time. You see less school-wide misbehavior, less school-wide gang membership, less victimization, less depressive symptomology, less substance abuse, increased GPA, and increased school climate. All of which would be completely impossible to see if we hadn't wrangled this data in a way that allowed us to do these school change models. So I hope this is a story not just about how valuable data can be to figure out what's going on, but how we need to utilize that data in ways that tell us what we can do with that information. Thank you.
We started this session with biostatistics. Sean is a joint appointee with us and CHS, and now we go full-fledged at CHS to Randall Kuhn. Randall has also a really, a lot of experience, rich experience in dealing with big data, and he's going to be talking about inadequacies of complex data systems currently available for answering complex policy questions. And I have a very special place in my heart for Randall because he's the only person I think in this school who speaks Bengali, which happens to be my mother tongue as well. There you go, Randall.
খুবই ভালো.
Which means very good.
Yes. Well, that's all that's left of my Bangla. But at least we don't have to do the fun fact. Sudipto took care of that. Oh my gosh, that sonification. How am I going to top that? Well, I'm not even going to try. Helpfully, I think I'm going to be describing the space of homelessness where, in a way, we need some of the big data that Sean and Hua are describing. I already have some questions for Hua, actually, about the VA data. Of course, the trick is homelessness is a very urgent crisis that affects us all, but most notably affects the many people whose lives are in jeopardy every single day living on the streets. And homelessness is what I actually came to this university from a School of International Studies. And it's what we in the world of international affairs, and certainly in my previous work in global health, we often encountered what we called a wicked problem. And they're just like big data. A wicked problem has no particular definition. It doesn't mean wicked like a wicked witch. It means basically a problem that is really, really complicated. And there are some specific dimensions to that, like both chronic and acute. And again, these all describe homelessness, both long-term and short-term consequences, solutions across multiple systems, devastating consequences, a problem that the closer you get to solving it, the harder it gets, right? Because we know, as with many problems like infectious disease, that we start with the easy cases and then we're left with the hardest cases. And so it gets harder and harder, and it's operating across multiple systems. And so part of the premise of this talk is to sort of say what we don't have, right? Which is, you would think that if we sort of take this systems view of homelessness, or if we take just the very seeming intractability of homelessness at our ground level view that we see in our lives, or if we take the complexity of the system. This is the county's, believe it or not, this is LA County's new revised simplified diagram for tackling homelessness. The previous one had all these lettered and color-coded different programs that was just a nightmare. So you would think that that a problem this complicated would have data systems that could represent the complexity of the problem. And you would think that a problem that can kill a person, bring a person from functioning very well, thank you, in a tent, in ways that we could never imagine, can go from functioning to dead in a matter of days, that we would have rapid response data systems that could meet the needs of this population. And of course, I'm here to say that we don't. Right? What we have is a system of periodic interactions between the system and homeless people, all mediated by caseworkers, right? No mechanism for people to self-assess. Like, we think about all the different systems where we self-assess, like say before we check in to health providers. And again, we can think about all the ways that our own health networks could use a lot more kind of data collection. And we know health and hospital systems are doing more and more to collect data on social determinants of health. But right, we have a system where all data systems are sporadic and selective in their coverage, where the decision for caseworkers to enter data comes at the cost of, do I actually help this person or do I enter their data? And systems that are fragmented, incomplete, and basically what I want to argue is not based on the person. And I'm probably going to jump through this. The basic premise of this slide is just that most of what we know about homelessness in LA County comes from what we call the point-in-time count. I'm part of the team that runs the point-in-time count. It's one of many great USC-UCLA partnerships that my work involves. And it's basically a count where citizens go out and count dwellings, tents, campers, so on. And then there's a survey that we run that estimates who's actually in those tents and campers and so on. And that's basically the foundation of what we know about how we're doing on homelessness in LA, is a single night count by lay people, by citizens, of the number of tents, and then a survey conducted once a year, right? You're homeless all year round, but we only have data on you in January, right? That estimates the number of people and some facts about the composition. And then we can observe that change from year to year. What happens during the year is we have these administrative databases, much like the administrative databases that Sean describes, except utterly fragmented, right? And so one challenge with homelessness is we don't learn that you're homeless the day you become homeless. And so there's that critical period right when you become homeless, when you're unobserved. That is sort of understandable. And that's one of the places that we could think about using big data to try to fill in some of the gaps in who is out there that we're not detecting. We are also using mobile surveys to come up with novel ways of tracking more quickly how people's lives are unfolding. Where you'd think there might be better data was in the housing system. So I was actually just on a call with some folks from eBay who were very interested in our survey work. I don't know why. But I basically had to tell them there's nothing, like users would imagine that our housing system, given that we're distributing 20,000 housing units a year, that we would have something like Airbnb, where a client could state their preferences, like I need to keep my pets, I need to be with my partner, I need to keep my stuff, I want to be sober, I want to be high. All these preferences that are pretty reasonable preferences to have. And more importantly, we know from our data that people have exercised their preferences. They are less likely to accept housing if they have stronger preferences, right? That you would think there's a database where someone could enter in their preferences and see the units that meet their preferences. And I had to inform them, quite the contrary. There is no database of housing. Not only is there no matching system, there's no database of housing. That is just in its rudimentary phase to actually have a database of what housing is out there, much less make it searchable. And then our work is really trying to get just at the very beginning, using mobile surveys to get an idea of what are people's preferences? What housing do they actually want? And then that's before we get to the question of when someone gets housed, do they actually stay in housing? And so, and again, the consequence of all this from the human, right? So part of what we're working on, and I'm already down to 1 minute, and of course I'm gonna go a little over, but I'm not gonna get to all the details of this, but part of what we're trying to do is say, how can we use all the data that are available? That is some classic big data like Twitter and things like that, but mostly an administrative database, data sets that are rationalized and organized into a system, and with a backbone of surveys where we actually ask people how they're doing. What do you want? What do you need? Are you recovering? Are you staying in your housing? Are you progressing from interim housing to permanent housing? And of course, are you surviving? And so I'll just say part of what we're doing, I'm not going to go into all the results, but we're running a real-time survey project called Periodic Assessment of Trajectories of Housing, Homelessness, and Health, where during the annual homeless demographic survey, our amazing team members, most of whom have lived experience of homelessness themselves, enroll people either by an enrollment card or using a little phone app, enroll them in a survey, not some fancy app. Again, we hear about a lot of people will say, oh, I'm going to design this amazing app that's going to navigate people through homelessness. And right, if solving homelessness were that easy that an app could do it, then we'd be having more success with doing it the old-fashioned way. We do need volume, right? We need ways for people to access services themselves, to solve problems themselves, but we need to do it in a human-centered, trauma-informed way. And so we have just a text message that links you to a survey that we spent a lot of time working on, the plain language, trauma-informed language, just ways to make a survey appealing. Like, how do you answer, what are the barriers to answering a survey if you're living under a bridge. And you barely have any battery power. And so that is, and the principal insight to all this is that 80 to 90% of unhoused people in LA have a phone. Not all of them have the phone turned on or have power or have the same phone number. So we're working through those challenges. During the pandemic, we figured out ways to deliver electronic gift cards, including some slightly healthy options for these surveys. Again, there's a data visualization platform and a report that we issued last fall that described that we've been able to generate a survey that is representative of LA's homeless population. We follow them every month. We just are working with the UCLA Institute for the Study of Hate on a new project to collect measures on exposure to everyday racism and violence. We just launched that survey and already have data flowing in. And this is a platform that supports quantitative and qualitative insight. In fact, because people's voices are so rarely heard, they actually love the opportunity to share qualitative insights, though we still try to not make the survey endless. We try to be mindful of their time. We do use administrative data. I'm not going to get to that. Here's some cool maps that my amazing PhD student, Jesse Chen, developed just using 311 data and other data sources to predict homelessness, right? So we can fill in some of the gaps on where new hotspots of homelessness are emerging during the course of the year. There is a little tiny bit of big data here, which is doing sentiment analysis on changing attitudes towards homelessness in the media. And yeah, I'll just leave it there. Sorry, I covered a lot of ground. We're just getting started. Thanks to our amazing partners at USC. We have a term for this, Bruins, Trojans working together, we're Brojans. Thanks to the Homeless Policy Research Institute, LA Homeless Services Authority. I know they get a lot of flack, but they're trying really hard. They're doing amazing work, and we're helping them become more lean and mean. And also shout out to Venice Family Clinic. We work with them on a new project mining their electronic health records from 15 years of street medicine practice to try to help all these cool street medicine programs actually make an impact. So thanks to you all.
And yes, I'd like to have the speakers go to their chairs for the question and answer session. We are a little bit behind schedule, but I hope you won't mind given these three magnificent talks that we have heard. I'll open it up in a second. Just a couple of quick points from my own perspective. What we saw here was with Hua introducing data technologies and resources available to all of you right here in FSPH in the form of courses and other expertise, and then Sean taking it on and presenting us with some really impactful studies based on big data in conjunction with traditional statistical principles of longitudinal design and so on, and Randall taking it over and bringing us to what we call multi-source data. I mean, administrative units as well as surveys. So none of what you're learning in your basic statistics courses or what you have learned is going away. A very common question I get from a lot of people is, well, if big data is going to be so prevalent, is sampling going out the window? No, not at all. I mean, sampling principles are still going to be there, but it's just that if you want to do data science in the sense of data-driven discoveries in public health, then you've got to use as much information as you can. And that's exactly what we see here through these panelists. So on that note, I think I'm going to open the floor and let's take some questions. Go ahead, Ray.
Would you all please share your thoughts on data sovereignty? And I asked the question specifically with the example of MStat versus Arizona State University.
Can you fill us in on the case you're talking about?
Sure.
No, I didn't understand. You said
So, Arizona State University had a study with Havasupai. That went fine, but then a few years after that, a different study team used that same data set to publish another health outcome that was unrelated to the initial study without the express consent, knowledge, or approval of the tribe. They lost that case. The Arizona State University lost that case.
I mean, one thing I'll say, this is an area where again, we use, certainly our consent covers only the uses the data are intended for. And that is, in a way, I'll say there are two separate realms here, right? Which is data that are collected under an IRB, so say survey data. Then when you get into the world of administrative data, of course, the administrative data are not owned by they're not owned by citizens, they're not owned by researchers either, right? They're effectively owned by the county. And what I'll say is that, this has been an area where the governance capabilities are not necessarily keeping up with the possible uses of the data and the possible applications. Now, I don't know that it's say there's the runaway potential like there is with machine learning, but the point is there are lots of potential use cases, and I'll say that in the realm of, this is what we call integrated data systems, right? So in the realm of integrated data systems, there have been all these innovations that have been aimed at essentially making it easier for data to be shared across agencies. And again, this is particularly in a context where, as I said, no citizen necessarily has a sovereign right to their own data, right? So this is essentially Department of Health Services, Department of Social Services, and Department of Public Health and LASA sharing data. And so what the county has tried to do, and again, we should really be having panelists out so the county has what they call the Info Hub, which is essentially an integrated database of everything that goes on in LA County. I like to say in LA County, in the absence of organized governance, we have a data system that can track all the places that we're failing. And so this data system is basically a handshake that, right, there's a single ID that links the person across all databases. Sorry, this is getting a little bit into the weeds. And then there's a handshake agreement that every agency agrees to have their data deposited into this Info Hub, but not agreeing to actually share their data for any particular project. And so this creates the conditions in which, right, that, and this is tricky, because that means like the police can veto their participation. Like there's a lot of cases where I think you're concerned about oversharing of data, but of course there are a lot of situations where there's undersharing of data, where, right, there are a lot of projects that would benefit from having police data, and police, of course, are often the last group to want to share data. And so I didn't quite get at your question, meaning in this world of multiple linked data systems, there are always many owners. But certainly when it comes to survey data, it would be, right, it's enough that as much as we would like to link the survey data we collect to the administrative data, we would never go back and do that without reconsent. And the nice thing about, I'll say one thing practical, the nice thing about having a monthly survey platform is that we can go back every month, anytime we need, and ask for that, ask for consent, and also say, part of what we thought about is letting users say, have a platform for discourse, or a platform for sharing their experiences with the survey. And that is in addition to all the usual lived experience advisory boards, which don't really cut it, right? They're not enough. But certainly the ability to ask for consent every time is important, and that needs to happen.
Yeah, I'll add to that. So I'll answer this in terms of the big data implications, right? So data sovereignty, big umbrella, data ethics, right? That's the bigger umbrella that you're really getting at, is what is the ethical use of data that was collected for one purpose but might be useful for another? That project is a great example of data ethics being too slow. They lost at trial, I'm guessing, this is sort of a legal assumption, but they lost at trial, I'm assuming, because they didn't follow IRB protocols, which were the governing principles under the case, and so it was a very easy decision for probably a summary judgment decision by a judge, and that was it. No appeal, that's it. But that's too slow. At that point, the data has already been breached and utilized, right? With big data, you tend to be pulling from big pockets, which is to say government entities that are collecting that data and making it available. That is driven by regulatory frameworks, not IRB. A law written by a state and passed by state legislatures are going to decide what happens if data breaches occur, and often it's you lose your funding, right? So there's a massive incentive structure for being appropriate with your use of data for academics. The same cannot be said of government entities that are often above the law. So police officers, police departments are very able to utilize data in new ways, in innovative ways, DNA data, for example, without worrying as much about getting in trouble because of the political relationship that they have to political entities. So I think if I were to take your question a bit broader and say, like, what are the big threats to big data privacy? They're not coming from academics. They're primarily coming from more politically protected entities that have access to a lot of really rich data, but won't get in trouble or won't worry about getting in trouble if they use it the wrong way. So if we're thinking about how we expand protections, that's where I would focus my attention.
Thank you. Thank you very much. Let's open the floor. Floor is open. Any other questions from anybody in the audience? Tom Bellin.
Tom Bellin from Biostatistics. Great discussions all around. I'd be interested in your comments, your ideas on what sorts of computing systems we need to have here to tap into and benefit from the available data sources.
Well, you want to go first?
Sure. Yeah. Computing is my favorite subject. I teach computing in biostatistics. So for the big data we are handling, there are lots of restrictions because of all the ethical concerns. Like for the VA data, we cannot move a bit of data out of VA system. Then that creates lots of challenges, right? I mean, if I cannot access data, and the computing system at VA is so kind of outdated. You really, literally, you can do very limited thing on that big data. That's actually what sparked that pilot study I mentioned, the collaboration between VA and DOE. The idea is, can we use the huge computing resource in DOE to analyze the VA data without bringing that data out of the closed system? So that's the route we took about that VA data. But for other data, every data has their own constraint and restriction. Like UK Biobank data, nowadays it lives in the cloud. So that's why also when I teach a computing class, I emphasize a lot, get familiarity with cloud computing, because sometimes you have to work in the cloud environment. That's my comment. So we are trying to adapt our training and curriculum towards the kind of computing environment data analysts, data scientists might be working in. Yeah.
Please, go ahead.
I would just quickly add, in addition to the computing concerns, I think the real need that I think about is the capabilities. And that is particularly, do we have the capabilities to do machine learning? But also, for me, it's really to do for problems that emerge in real time. Do we have the capability to use super longitudinal or real-time data? And that is, I think biostatistics has those capabilities. I don't know that we're always able to fully tap into them, but we need to. I need to go back and get like a mid-career retraining grant, because it's very different. I mean, we probably a lot of people in this room have used longitudinal data, but using longitudinal data where you say have 1 million observations per person is quite different.
Go ahead, please.
Yeah, I was just curious, and maybe I'll ask Sean this, but about the quality of some of this data. So, for instance, you did a wonderful job of quickly explaining something, but I was sitting here thinking, I would imagine some schools keep much better track of disciplinary actions or even the race of the students or what have you than other schools, and I'm just wondering, how do you approach that issue of quality of this data?
Yeah, I would say initially there's a go, no go decision when you get the data and you see if there's the kind of variability in the data quality across schools that you don't want to see, and then you don't take the project on. So there's definitely a little bit of like, don't trust everything. But there's also a data generation decision. So we worked with a district that, because of its school practices and its funding from the federal government, was requiring very detailed trainings for school administrators to collect this data in exactly this one way. So in the article, we spent quite a bit of time talking about how the data generation process was quite reliable in each school unit. And our own checks of that proved to us, at least, the data generation process seems to be following what we'd like. Same for the student survey data. California Healthy Kids Survey has an obligation to try to hit 70% of students in any given school that they survey in any given year. And if you cross-tab that by school grade or race, or you see 70-ish%. So there are ways to sort of check that. But I think at the beginning of all of that, it's sort of saying, is this data reliable given the parameters of this project? And I think a lot of data scientists, I count myself among them, can be tempted to take on projects because the data has a lot of N, but that doesn't mean it has a lot of quality for the purposes that you're trying to utilize it for. So it's being very circumspect about if this data set were smaller and it had these same features, would I still trust it? And then moving forward, if you would, and continuing to do what you need to do to check on the back end that the data generation process is unfolding as it should.
I'll just add, as a general rule of thumb for assessing, for thinking about the logics of an administrative data system, I would say problems emerge with administrative data. The more dispersion you have of the more mobile the population is, and of course the other big variable is there money involved in the collect, right? Will you lose money if you don't collect these data? But on the dispersion issue, right, schools are unique in that there's a lot of context in a school in which you have the exact set of students, with the exception of those who are absent or truant, that makes administrative data in schools a relatively good bet. And then you'd say, well, clinics are a little bit harder, shelters are a little bit harder, and then of course homeless street outreach becomes just all bets are off. And that's right. And that's where you really need, I think this is another area where validation surveys, where you actually have surveys where you can match those, with appropriate data governance and informed consent, matching those surveys to the administrative databases just to assess coverage and really to triangulate, say, between 3 systems, is actually where I hope, say, that LA can go, is say, this person is homeless in the EHRs, they're homeless in the homeless database, the homeless shelter database, and they're, say, are they homeless in a survey? And if you kind of, once I do it like a capture recapture across multiple systems, you can really get a scope of who's where in what system.
I'll just add one thing to what Randall said, if possible.
Just quickly, yeah.
A plug for qualitative data not being replaced by big data. If your concern is that big data make a signal that is actually noise and you want to vet that your data generation process is what you think it is, look at it. Put people in schools, right? Watch how people are filling out these forms in different schools and seeing if there's variability. See how people are coming into clinics, see how people actually use qualitative data as a multiple informant source to vet your data generation process. It shouldn't be replaced.
Thank you so much. This is too exciting, but unfortunately, time speaks, and we are out of time. I'll just say one quick thing. Data science has enough scope, right, for a lot of different intellectual endeavors. It's not owned by statistics. So whatever you're doing, whatever be your profession, come reach out. Let's make this a wonderful synergistic school where we can come together and solve problems regarding big data or any type of data, all right? So I think let's first of all give a big round of applause to